Hi everyone, my name is Kylie Millington, and today I'm going to be doing my CRI 380 War on Drugs project on methamphetamine. All right, so let's get into it. Okay, so here on the right, I have a 1-800 number that is supposed to help if you or someone you love are struggling with methamphetamine addiction. So to begin this presentation, I have the National Meth Awareness Day. November 30th is declared National Meth Awareness Day to bring awareness of the effects of methamphetamine on families and communities. You can use the hashtag Meth Awareness Day on social media to bring awareness on methamphetamine use. And in 2006, on November 30th, signed by former President George W. Bush, the proclamation was set forth as November 30th would become the National Meth Awareness Day. So what is methamphetamine? Methamphetamine is a synthetic stimulant that is addictive and can cause considerable health adversities that sometimes result in death. Meth can be smoked, snorted, injected, or taken orally and is often used with other substances such as cocaine or amphetamines, but those are not limited to those. There are 3 different types of methamphetamine. They include crystal meth, speed, and base. As mentioned before, people can smoke, inject, snort, or swallow a pill of methamphetamine. In some cases, people take methamphetamine in a form of binging, known as run, giving up food and sleep while continuing to take the drug every few hours for up to several days to get a better high. So some forms of methamphetamine here. The first one I'm going to mention is crystal meth, which is also known as ice, that can be smoked, and it is the most common form as people see. Right here on the right, we have speed, which is a powder meth that can be snorted, similar to cocaine. And right here on the bottom right, we have base methamphetamine that can be smoked, snorted, and it comes in multiple different colors, such as yellow or brown. In this photo here, we see it is more of a yellow. So some statistics on methamphetamine use on the right-hand side here, I have from 1999 to 2019, number among the ages for drug overdoses, primarily on methamphetamine. From 2015 to 2019, the number of deaths linked to methamphetamine use rose from 5,526 a year to 15,489 a year. So roughly it's 180% increase. About 2 million people aged 12 years or older use meth in any given year, while about 500 people each day try meth for the first time. And between 2015 to 2019, methamphetamine was primarily used by white people historically. However, American Indians and Alaska Natives had the highest prevalence of methamphetamine use, as well as methamphetamine use disorder and methamphetamine injection. So some short-term effects on methamphetamine use, there are increased wakefulness and physical activity, decreased appetite, faster breathing, rapid and or irregular heartbeat, increased blood pressure and body temperature. And in even taking small amounts of methamphetamine can result in health effects. Those are similar to cocaine and amphetamines, as I had mentioned before. So here on the right-hand side for this photo, we have someone looking at what looks to be powder meth. So there are long-term effects of methamphetamine use. We have anxiety, sores on the skin, violent or aggressive behavior, memory loss, mood swings, excessive weight loss and malnutrition, major dental issues such as tooth decay, gum disease, or loss of teeth. We have nasal irritation, which come from nosebleeds, and perforated septum for people who snort meth. Then we have track marks and increased risk of contracting HIV and hepatitis in people who inject methamphetamine into their veins. So these photos here on the right, so we see what a progression of before and after methamphetamine looks like. And these are mugshot photos of people. So clearly you can see there are sores on the skin. You can tell that their eyes are dilated here. And also you can see that there is major dental loss. And the bottom photo, she doesn't even look like she's honestly a wig, let alone there. That could also be an effect of methamphetamine. You just really have such a high that you like start to go dazed and confused. So, a case involving methamphetamine. The picture we have here is Edward Buck, who had taken the lives from two African American men. So Edward Buck was convicted on Tuesday, July 19th, 2021, of charges that he had supplied methamphetamine that killed two men during a party and play encounter at his apartment. He also almost had a third victim. However, the third victim had escaped and did not die of a drug overdose. So he was able to tell a story on what had happened. So the two victims fell to Buck's unfortunate methamphetamine party and play were Jamal Moore and Timothy Dean. And it was stated that Buck had a dangerous fetish, which led to the death of the two African American men. So the verdict concluded with a 2-week trial that featured harrowing testimony by the men hired by Buck to show off their bodies in underwear and get high on crystal meth, and another party drug known as GHB. The trial was grueling as they had seen multiple video footages of what was going on in Buck's apartment as the victims were high on methamphetamine and Buck was obviously not, and he was inappropriately touching them. And it was just something that the jury was very firm on making their verdict for because he basically violated and caused the drug overdose of these two men. So, some treatment for methamphetamine use. So, as I mentioned before in the slide about the National Meth Awareness Day, the phone number that can be useful to find information about treatment, how you can be helped, is 1-800-662-4357. Those last four would be help. Intervention and detox, counseling and therapy and aftercare and support groups are key into helping someone quit using methamphetamine. Now, those are all in order. However, not very many people do start with an intervention because it could be hard to gather the person and then they can become violent and not want to be a part of the treatment. So it's always better to try to use a medical professional versus just yourself as you if you're not sure what you're doing. So support groups are a great source of help for people when it comes to aftercare. So it is great for people to engage in these groups to help themselves. It's always better to help keep the addict's mind at ease and not, start to trigger them and, losses or grief or anything that may have a dramatic change in their life could help them relapse. So it's easier to have that help for people, especially when it comes to aftercare, so they don't decide to relapse. So the goal of intervention is to help people struggling to get in addiction recovery and rehabilitation. A detox is medically supervised by professionals and ensures a safer and more successful treatment plan. Therapists help recovering meth users identify the underlying reasons behind their drug use and provide the emotional support needed to work through those issues. So here I have the first slide of my references here for all of my slides. And then the second part of my slides. And I thank you very much for taking your time to watch my presentation on methamphetamine. And thank you.